Great, good evening. I too would like to acknowledge the traditional owners of the land on which we meet today and pay my respects to elders past, present and emerging. It's lovely to be here, and my plan is really just to talk to you about what's happening up the road, just up the road at Logan Hospital, because there is a lot going on, and there will be a lot going on at this point in time. So really just to paint you a little bit of a picture around what's actually going to be happening. Logan Hospital, as you're probably well aware, is part of the Metro South Hospital and Health Service. So we have a number of hospitals in our region, which is really sort of south of the river. The tertiary hospital is the Princess Alexandra Hospital, but Logan Hospital is the second largest hospital in the area, Redland Hospital, QE2 Hospital and Bow Desert Hospital as well. So we have a very interesting and diverse workplace. Logan has really grown from a community hospital, and in fact Ambulance still calls it the Logan Community Hospital, which I always think is fairly entertaining, from a 48-bed community hospital in 1990 to a 448-bed hospital in 2017. And for me it's been an interesting journey, because I was here in the early 1990s as a psych registrar, as a junior trainee. I loved it, really enjoyed my time out here as a trainee, never envisaging that one day I would actually be back here, and it would have grown so enormously. At that time you essentially could sort of come to work and pull up almost outside the front door, park your car and walk in, 15, 20 metres past the little volunteers kiosk that used to sell food at that point in time and sandwiches. So we don't have that luxury at this point in time, and in fact car parking is one of our biggest challenges, as you might have noticed. So we provide a whole range of specialties as well, and we do have specialists, and we are increasingly able to attract specialists in the public sector, particularly down here at Logan. It is really recognised. And in fact, we have a new Director of Nursing filling in for the moment who said, you have amazing doctors down here because they have a very can-do, innovative attitude. They don't say, we need more resources, this is, we need more this or that. It is, how can we make things better for our patients? And to be honest with you, that is not always something you hear from medical staff, myself being a medical staff member as well. But they do say, this is not good, how can we make things better? And it goes across the board for all of our staff, nursing, allied health, but also all the support staff as well. I think one of the things we've recognised is the real importance of all of our support staff. Cleaners, for example, are a very integral part of our service around ensuring that the hospital is not only clean, but it's an integral part of our infection control. We have paediatrics and maternity services here at Logan Hospital, and that is really an area of major growth, and I think the Mayor has already acknowledged that this is an area where we're seeing growth in young families out towards Yarrabilba and Bow Desert, large amounts of young families moving in, having babies and needing to have services in their local area, and I'll talk a little bit more about that. But we're also seeing, and we're aware that there is an ageing population in the area because people are moving into this area, into retirement villages and nursing homes as well. So we do provide really the whole spectrum of services. We're also a teaching hospital, and we are very actively engaged in training our future workforce. And I think this is one of our strengths and one of the things that we will be looking forward to in the future. We train nursing students, we train medical students, but we also train allied health students, and we are very, very keen on progressing a local workforce, and that's something that we are really interested in. We don't want to be importing people from other areas. We actually want to provide growth, and that people who are working here at Logan Hospital and the associated services are actually people who are born, bred, went to school in the area. And we've got some innovative small programs around things like school-based trainees, which has been an enormous success, and we're really looking to expand that type of an approach where students from Maple Park High School spend a year coming in and working with us 1 day a week. They are paid for that. We do support them, and then they go on to do a qualification during that period and can come back into our pool as AINs while they go on to pursue nursing degrees in general, and a lot of them have done so. And the really nice thing about that is that it does provide a pathway of employment, but it also means that students coming into the hospital actually get a sense of what nursing is really like. And so how many people do we know that go into a university course and then realise it's not for them? It's not really what they ever thought it was. So we're really keen to actually partner with Griffith University. We already have a strong partnership, and with TAFE and with other institutions around growing the workforce essentially in the local area. Our medical students really like coming here, and we are also a site where we have people seeking to do their internship at Logan Hospital as well. 2 minutes. There you go, better speed up. And in fact, places are very sought after and people stay here. And one of the reasons that people stay here is because they get the breadth of medicine, they get a breadth of exposure that you don't get at tertiary hospitals where you might be on a very singular track. You actually get to do things here at this hospital and really learn. So currently we have 448 not only beds but bed equivalents, so it sounds bigger than it actually really is. Over 2,000 staff. We have the second busiest emergency department in the state most of the time. Occasionally Prince Charles beats us out for that, but they have much lower acuity, so very high acuity presentations. And I am told that we have the fourth busiest emergency department in the country here at Logan. It's extraordinary. And yet part of the difficulty we have is that the back end is not yet big enough, but I will go on to talk about what that means. We have lots of challenges, and I think that has been, we've already alluded to that, so we don't need to actually dwell on that. But needless to say, we know there's significant socioeconomic disadvantage in some areas. We also know we have a high rate of people who've been born overseas who don't speak English as their first language at home, and that we have a high proportion of refugees as well, and other disadvantaged populations in the area that we are very keen to actually partner with to provide sensitive services towards, provide better accessibility, but also to strengthen our workforce in that area, so draw from these communities and actually build our workforce. I've already alluded to this. We have a significant capacity mismatch between our emergency department and our inpatient units at this point in time. I think the first thing that I did when I came down here 3 years ago was I kept appearing on television trying to explain ambulance ramping in 10 seconds or less, which is pretty much what they gave me. So, but we do have some big plans around expanding here. So hopefully I'm on the right slide. So the 2017 state election funding commitment committed to expanding and upgrading Logan Hospital and adding 192 beds at this point in time, and the detailed business case is being developed at this present point in time, and we anticipate that building will come out of the ground sometime in the next year or two. Debbie, I'm looking at you because there's been some hiccups with this, but the government has fully supported that, and we will be adding on to the building at the front of Logan Hospital where the new emergency department is. We'll be going up another 4 floors at that point in time. We've also had significant funding announced for expansion and refurbishment for our maternity services space, an area of great, what would you call it? It's a little outdated. That might be a very kind description of that service, and there has been a lot of community awareness of this and a lot of community support for upgrading and improving our maternity services, and we now actually have the detailed business case going ahead. It will go to essentially through to government later this year and early next year, and we anticipate that building will start soon and it'll be completed by December 2020. So that's out the back of the hospital, which will be fantastic. There is also a feasibility study in place to expand our ambulatory care and with potential urgent care areas in that as well, because as you build inpatient capacity, you also need to build your specialist outpatient types of services, so we're actively engaged in that. We have a plan to build a transit care hub as well, and the feasibility studies underway in relationship to that, and we're currently in the progress of developing a detailed business case for a multi-storey car park. Some slight recent hiccups, but we are very hopeful that that'll get over the line. I never believed that when I went into health I'd spend a lot of time talking about car parks, but there you go. It is a very, very important area. So I'll wrap it up there. Unfortunately, I can't stay much beyond this point, but I will be back tomorrow morning, and we do have some Metro South Hospital and Health Service and Logan Hospital employees in the area who might just pop their hands up, if you don't mind, saying, pointing themselves out so that they can actually also be available to answer any further questions, because it is a big and comprehensive piece of work. So thank you very much.